News.mc on Monaco Info is brought to you by Monaco Legend Properties. Our exclusive interview with the personalities driving the Principality.
My name is Enrica Segond. I'm a plastic surgeon and I come from Italy. I was born in Catania. It's a city in a very beautiful island in the south of Italy. I'm from Sicily. I've been plastic surgeon here in Monaco since almost 30 years, and I recently opened a new clinic. La Clinique Monte-Carlo is the first clinic of aesthetic surgery here in Monaco. I've been coming in Monaco when I was, I think I was about 12, 13 years old. I was coming here with my parents. My father was fond of Grand Prix, so I was coming with my parents like a tourist. I met a friend here, a girlfriend, who made me also encounter a lot of Monegasque people, and among them I met a young Monegasque man who is now my husband, and that's the reason I moved from South Italy to Monaco, the fact that I wanted to follow him. When I met him, I was in my studies of plastic surgery in Italy, and so I finished my internship in France. I was a long time in the hospital in Nice, and then I've been, of course, traveling a lot because of my job. You know, to be the best in this practice, you need to learn from the best, so this made me traveling all around the world to go and see eminent surgeons in this specialty. For me, it was a little paradise. This little country who is on the coast of the Mediterranean Sea, it made me feel like home. I come from an island, so we have a little town in Sicily called Taormina. We call it the Little Monaco, as it used to have a casino when I was very, very young. The coast and the village looks a little bit like Monaco. We have a village with in the upper part of the coast, the lower part of the coast with the seaside. And so when I arrived in Monaco, I said I think I could make my life here without missing home. Since my young age, I was really patient about the anatomy of the body, how we made her, how the body is made, how it works. Really, it was like a hobby for me when I was a young girl. Of course, also thanks to my father, who was a general surgeon. This let me go very close to the medicine, to the surgery, because I remember when I was very young, I was asking him to let me come in the operating room with him to observe surgery. I can say I was passionate about medicine since my young age. When I finished high school, I enrolled to the medicine school, and then I met, during my internship in medicine, I met a professor of plastic surgery who was taking care of malformations. And I remember, I cannot forget this day, he was operating a young girl of cleft lip. I think this day changed my life. I decided to become a plastic surgeon that day, to see how we can transform a life, the future life of a little girl, how I could see the joy of the parents the day they discover the new face of their little baby. I think this makes me think it was my calling. This was the way I wanted to do surgery. It's true that time changed and my desires also changed, and my wish was to create a clinic of aesthetic surgery in Monaco. So I met Dr. Beros, who is a very good friend and colleague. So we decided together to do something. So on my side, I was taking care of the aesthetic surgery department, and he wanted to offer also to Monaco new activity, is the laser vision surgery. It was not here in Monaco. And we also decided to open a new department who was missing also in Monaco, is a hair transplant department. So we combined our expertise, our specialty, and we created La Clinique Monte-Carlo, who offers different specialties. We welcomed other doctors, so there are other doctors in these specialties working with us. The aim is to have for Monaco the excellence, the best expertise. So we have doctors, they are bringing this to Monaco, to Monegasque patients, but also attracting patients all over the world for their experience and their expertise. You can practice in Monaco even though you are not Monegasque. We don't have enough specialists in medicine who are Monegasque. But to open an office, you need to be Monegasque. But you can associate with other strangers and let good doctors in our specialty or in any other specialties to work if they are coming in your office or in your clinic. Also at the Princess Grace Hospital we have a lot of very, very good friends coming from Italy or from France. They are not Monegasque, but they can get authorization to have their activity in Monaco. I see, as a plastic surgeon, I see patients coming for reconstructive, but I see also patients coming just because they want to feel better in their age, or they want to correct some defects that are difficult to live with. In fact, I moved from reconstructive surgery at the beginning of my career to aesthetic surgery. That's why I could move from reconstructive to aesthetic surgery. For me, it's a surgery of well-being. In aesthetic surgery, I think we have still a little bit more women coming than men. We are taking care of a hair transplant surgery. So here it's a surgery where most of the time the patients are men, because it's a problem specifically, especially for men, that he can be treated with surgery and gives very good results. But we have especially women asking for surgery, but we see the tendency since maybe the last 10-15 years, so we have more and more men coming. The tendency is for women and for men, it's the asking for less invasive procedures, the best natural results. So I think that's why men are coming more to aesthetic surgery, because now they can see that with the new techniques, with this less invasive technique, we can get natural results. And I think the first demand of men when they come to see us is, I don't want nobody to see I have done surgery. I want just to be better, to feel good, to be healthy, but I don't want people to understand I had some surgery on my face. In aesthetic surgery, it's more a question of techniques who have been changing. Techniques were much heavier for the patient and also more risky. They have become softer because the knowledge of the anatomy is much better. We know exactly where we have to work without taking any risk for the patient. On the other side, aesthetic surgery goes with aesthetic medicine. And in aesthetic medicine, we have a lot of technology. I believe that regenerative medicine is the future for aesthetic medicine or for aesthetic surgery. We have different surgeons and different doctors all around the world working on it, and we have one of them in our clinic who comes from Italy. Regenerative medicine is not only for aesthetic medicine. It's a medicine who works in all body. So there are orthopedists working with it to improve joints, to improve ligaments, in the dentistry, in any part of the medicine. There is a growing interest to this medicine. For me, aesthetic surgery is not a question of changing a person. So usually I don't like to respond to demand of changing. I remember once there was even a patient coming with this cat, and she told me, I want to look like my cat. I don't know if you ever heard it. There are the fashion of foxy eyes. There are people, they want to change, to become like an Asiatic, or they are European. I mean, there is a lot of demand about anything. One of my passions is traveling with all together. So we have seen most of the country. I have a list. I put my cross every time we visit a new country. And I never been in a country that has all this quality than Monaco. It can go from the weather, the professionality in job, the security. But I see there are a lot of young people after their study coming back in Monaco. So there must be something special in this kind of life to attract any age, and a lot of also foreign people coming here and become resident here because they like to live here. I don't think I could imagine that it was going to become so innovative in so many fields. In my field, I see that for health, now we have an hospital in Monaco, and we are going to have the new hospital in Monaco, and I'm sure it will be one of the well-known hospitals in Europe. I'm sure. I don't know if I will be able to be here to see that, but I see that everything is doing to attract the best practitioner, the best practice, and I think this is very, very important. I would say the passion for my job. I think when you have a passion, you can do a lot. You can do it all. I remember during my studies, I was always excited by my job, and the days are very long for a surgeon, but it never bothered me. I was excited and doing anything I was doing. I can thank God every morning to do the job I love. And of course, if you have a passion, you can conciliate. You can be a wife, you can be a mother, you can be a daughter, you can be a friend. Of course, sometimes you have to make choice. I would say, for my part, I have been always try to prioritize my family. Sometimes I had to sacrifice some professional opportunity. I remember I was feeling guilty sometimes towards my children. I tried to spend most of the time with them because, time never comes back, so time lost is lost. So sometimes it's difficult to live with this guiltness, but I think you can do it all.
That's all for today. Thank you for watching News.mc, your English rendezvous on Monaco Info. Discover more interviews and stories on our websites, news.mc and monacoinfo.com. This show was brought to you by Monaco Legend Properties.